Anxiety disorder. It is a condition where a person feels excessive worry, fear, or nervousness that affects their daily life. It can cause physical symptoms like fast heartbeat, sweating, and trembling. People with anxiety disorder may find it hard to control their worries, even when there's no real danger. Treatment often involves therapy, medication, or a combination of both to help manage symptoms and improve quality of life. Depression disorder. This disorder is a condition where a person feels sad, hopeless, or empty for an extended period. It can affect how they think, feel, and handle daily activities. People with depression may lose interest in things they used to enjoy, have trouble sleeping or eating, and struggle with low energy or motivation. Treatment usually involves therapy, medication, or a combination of both to help manage symptoms and improve overall well-being. Bipolar disorder. It is a mental health condition where a person experiences extreme mood swings that include emotional highs and lows. During manic episodes, individuals may feel very energetic, euphoric, or irritable, and engage in risky behaviors. During depressive episodes, they may feel sad, hopeless, or lose interest in activities they once enjoyed. These mood swings can affect sleep, energy levels, and daily functioning. Treatment typically involves medication and therapy to stabilize mood and manage symptoms. Neuro Cognitive disorder. This disorder, sometimes called dementia, is a condition where a person's brain function declines, affecting memory, thinking, and behavior. It can make it difficult for them to remember things, solve problems, or communicate effectively. Neurocognitive disorders can be caused by various factors such as Alzheimer's disease, stroke, or traumatic brain injury. Symptoms may worsen over time and can impact a person's ability to live independently. Substance use disorder. Substance use disorder, often referred to as addiction, is a condition where a person becomes dependent on drugs or alcohol, leading to harmful consequences in their life. This dependency can cause them to crave the substance, use it even when it's harmful, and have difficulty controlling their use. Substance use disorder can impact a person's physical health, mental well-being, relationships, and ability to function in daily life. This can be treated by therapy, medication, and support groups to help manage cravings. Eating disorder. An eating disorder is a mental health condition where a person has unhealthy eating habits that can harm their body and overall well-being. There are different types of eating disorders, such as anorexia nervosa, bulimia nervosa, and binge eating disorder. Eating disorders can have serious physical and emotional consequences, including malnutrition, heart problems, and depression. Treatment often involves therapy, nutritional counseling, and medical monitoring to help individuals develop healthier relationships with food and their body. Obsessive compulsive disorder. It is a mental health condition where a person has recurring thoughts or fears that lead them to perform repetitive behaviors. These obsessions and compulsions can interfere with daily life and cause significant distress. For example, someone with OCD might have an obsession with germs and feel compelled to wash their hands excessively to relieve anxiety. Treatment for OCD often involves therapy, such as cognitive behavioral therapy. Sleep-wake disorder. Sleep-wake disorders are conditions that affect a person's sleep patterns and daily wakefulness. These disorders can include problems falling asleep, staying asleep, waking up too early, or having irregular sleep-wake cycles. For example, insomnia is a common sleep-wake disorder where a person has difficulty falling asleep or staying asleep. Neurodevelopment, a condition that affects the development of the brain and nervous system, leading to difficulties in learning, behavior, and socialization. These disorders typically begin in childhood and can persist into adulthood. These disorders can vary in severity and can impact a person's ability to function in daily life. Treatment often involves early intervention, therapy, and educational support. Sexual dysfunction disorder. This disorder is a condition where a person has difficulty experiencing sexual arousal or satisfaction, which can affect their ability to have a fulfilling sex life. Two main types of sexual dysfunction disorders are erectile dysfunction, premature ejaculation. These disorders can be caused by various factors, including physical health issues, psychological factors, medications, or relationship problems. Treatment often involves therapy, medication, and lifestyle changes. Panic disorder. It is a type of anxiety disorder where a person experiences sudden and intense feelings of fear or panic, often without any obvious reason. These panic attacks can include symptoms like rapid heartbeat, sweating, shaking, and shortness of breath. People with panic disorder may worry about having future panic attacks and may avoid situations or places where they fear an attack might occur. Treatment for panic disorder often involves therapy, medication, and relaxation techniques. Dissociative disorder. Dissociative disorders are mental health conditions where a person's sense of self, memory, or consciousness becomes disrupted, leading to a disconnection from reality or identity. This can involve experiencing gaps in memory, feeling detached from oneself or surroundings. Treatment for dissociative disorders typically involves therapy, particularly approaches such as trauma-focused therapy or dialectical behavior therapy. Paraphilic disorder. It are a type of mental health condition where a person's sexual interests, fantasies, or behaviors involve objects, activities, or situations that are considered atypical or socially unacceptable. These interests can cause distress or impairment in functioning. It's important to note that having a paraphilic interest or fantasy does not necessarily mean someone has a paraphilic disorder. Treatment for paraphilic disorders may involve therapy, medication, and behavioral interventions aimed at reducing harmful behaviors and managing symptoms. Schizophrenia disorder. Schizophrenia is a mental health disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may have difficulty distinguishing between what is real and what is not, leading to symptoms such as hallucinations, delusions, and disorganized thinking. Schizophrenia can also cause changes in mood, motivation, and social functioning. Treatment typically involves a combination of medication, therapy, and support to help manage symptoms and improve quality of life. Disruptive impulse. It is a mental health condition where a person struggles to control their impulses or urges, leading to behaviors that can cause harm to themselves or others. These behaviors are often impulsive and occur without much thought or consideration of the consequences. These disorders can interfere with relationships, work, and social functioning. Treatment typically involves therapy, medication, and behavior management strategies. Somatic symptom. This disorder is a mental health condition where a person experiences physical symptoms that are very distressing or disruptive, but no medical cause can be found to explain them. Some of the examples are pain, fatigue, neurological symptoms. People with somatic symptom disorder often become very preoccupied with their symptoms and may frequently visit doctors or seek medical tests and treatments in an attempt to alleviate their distress. Binge eating. This disorder is a mental health condition where a person frequently eats large amounts of food in a short period of time, feeling a lack of control over their eating during these episodes. Some key features of binge eating disorder include: Number 1, eating much more rapidly than normal. Number 2, eating until feeling uncomfortably full. Number 3, eating large amounts of food when not physically hungry. Number 4, eating alone due to embarrassment about the quantity of food consumed. Binge eating disorder can lead to health problems such as obesity, heart disease, and diabetes.